If you have been thinking about increasing the size of the breast because you've always been worried about a small breast, then this video will help you to understand the options that are available to increase the size of your breast. So many women actually have a smaller size breast than the body proportion, or some have normal breast but desire to have a bigger or and more fuller breast. But there are also women who are happy with their size of the breast, but after pregnancy and breastfeeding they feel that they have lost some volume and also the breast have sagged. So all of these women aspire to have what we call breast augmentation or increasing the breast size. So what options available currently to increase the size of the breast? The medically approved procedures are a breast augmentation using a implant. The shell of the implant could be made out of silicone or a polyurethane, with the fill inside that is usually silicone or a saline. Also have volume replacement done through your own fat, which is called fat grafting. Now we are also getting what is called body fillers, where you can put hyaluronic acid based filling material to increase the size of the breast. So let me discuss the advantage and disadvantage of each of this. So we'll start with the most standard consistently which can give you the desired result is breast augmentation with an implant. So implant is a synthetic ready-made available material which is available in variable sizes. Normally, when you want to get a breast augmentation, you want to understand how big you want your breast to be. So what cup size of bra that you eventually want. So the normal variability between a B, C can vary from 150 grams to 250 grams depending on your body proportions. This will vary the size of the cup and also between different bra company brands. Today you also have softwares that are available which can tell you how through a 3D imaging using AI, it can tell you when your breast filled with a 300cc volume, how will it look. I can give you a simpler method to understand how it can vary. You can also take a balloon which can be filled with a 300cc water. It may not be actually like a 3D visualization. When you fill water in the balloon, depending on how tight you tie or how loose you tie, it can take the shape of the breast. But don't tie it too tight. You tie it reasonably loose, and that volume, when you place it inside your bra, it can help you to understand how the difference volume enhancement it can give. So breast augmentation using silicone implant, the size of which will depend on how much volume enhancement that you desire. So roughly for somebody less than 60 kilos, if you want to go from A to a C cup, you will need minimum 300cc implant. Now suppose you're over 60 kilos, somewhere around 75 kilos, and you want to go from A to the C cup, you will need about 200cc per cup. So that's about 400cc implant that you will require. And implants also come with different profiles, which means it can be a low profile, medium profile, or a high profile or extra high profile. What this means is, let's say take 300cc, if it's a low profile, it will have broader base and smaller height. So if someone has what we call a tuberous breast, they will actually need implant with little broader base to increase the base. Whereas if someone has lost volume because of after breastfeeding, multiple pregnancy, lactation, then they have loose tissue, and so you need have high projection to fill that loose volume. And then after you decide the size and the profile, the incision through which the implant is inserted. So the implant can be placed just behind your breast tissue. So breast tissue, which is enveloped by skin, and we have fat and gland tissue, below which we have a fascia which covers your chest muscle. Then you have your chest muscle. Then you have the rib cage. So young girls want without any disturbance on future breastfeeding, and you don't want to handle breast tissue at all, then you simply go through what is called an inframammary incision, where under breast line already you have a sort of an impression there in the under breast. So through this line depending on where we want to place the implant, we just place it. If it's a very young individual and we want the implant to stay there for longer time, it's better to anticipate that when you put implants, the tissues above that, because tissues below that cannot be compressed, the tissues above that can be compressed, they become thinner. So if someone already has a very thin breast and fat tissue, it is preferable to insert the implant under the muscle, so you have additional layer. But if you have sufficient breast tissue, you can insert the implant just below your breast tissue or even just below the fascia, because you have one thin layer which gives an additional support. Now, the advantage of putting below the breast and below the muscle, if someone is into regular physical activity which involves contraction and relaxation of your chest muscle, and if the muscle is not released correctly, when we put the implant below the muscle, you can have an animated effect. And so it's very important to understand the lifestyle of the patient who's undergoing the procedure, and also to examine the thickness of the skin breast tissue envelope and the expectation of the patient. So if you want a very well defined cleavage to be visible, then of course if you put it just below the breast or the fascia, the cleavage and the visibility can be much higher. But it's not that if you put it under the muscle, you cannot get that cleavage. You may need some additional fat grafting to define certain areas. So when it comes to breast augmentation, if you look at the procedure, breast augmentation with an implant, the procedure doesn't take more than 1.5 to 2 hours. It's done as a daycare procedure. You'll be asked to wear a compression garment, and when you go home, the protocols have evolved tremendously over the last decade. Nowadays, not too many surgeons will restrict your mobility of your arms. They allow you to do as much work as possible that the pain tolerate. Obviously, not go to the gym the next day after surgery or vigorous dancing activity, but you can do your small work, but you will have some pain discomfort depending on the plane in which the implant is inserted. If it's inserted below the muscle, the pain discomfort factor can be a little higher, or if you put a very big implant which is stretching the soft tissue envelope, then also you can have a little more pain and discomfort. So this is with regards to breast augmentation. Now the common question that runs in your mind, will I develop any complication? Definitely, with properly executed breast augmentation with implant, you should not get any life-threatening complication. Of course, established complications that you should know about are what is called implant infection. Anyone can get an implant infection, but the incidence is very, very rare. And if you get infected, the treatment process is also very standardized. You don't have to worry, just remove the implant on the side in which it is infected and give antibiotic, take oral medication, the infection will settle down. After 3 months, you can reinsert the implant. The next complication that you need to be aware of is what is called a capsule contracture, where after the implant is inserted, the body forms a shell over the implant, and this shell, it tightens or shrinks, which we call contracture, and that pain that you feel when the breast is actually tightly squeezed, that is a feeling that you will get when you have capsule contracture, in addition to the breast feeling hard and tight. So in such instance as well, we have to remove the implant and of course remove the capsule and allow the tissues to return to normal anatomy and reinsert the implant again on that side after 3 months. Now the most important question is whether you can get cancer after breast augmentation. Now the established studies, there are not enough scientific papers to say the incidence of breast cancer will increase with implant, because after breast cancer removal, that is when somebody has breast cancer and the breast tissue is removed, reconstruction of the breast is also done with implant. So there are no studies to say that the incidence of breast cancer increases with implant. But there are some articles and publications and studies which says the type of cancer that can occur in an individual with an implant could be different from the normal. Probably because there are additional tissues that are forming in the breast like a capsule, which may not be a native tissue that is present in the breast. So there are papers which says squamous cell carcinoma or an ALCL. These are not type of breast cancers which are normally that comes in the breast. In the breast we normally get ductal carcinoma or a inflammatory carcinoma of the breast. So we have cancers which come specifically from the breast tissue which are normally present. But because of implant, probably there are newer cell types that are being formed there from which you can get a different type of cancer. So you don't have to worry. Just because you put an implant, you don't stand a higher chance of getting a cancer. So that is what the study says, because implants are also used to reconstruct breast after breast cancers. So this is what you need to know all about breast augmentation using a silicone implant.